Hello everyone, Dr. Fink here. Today we'll talk about the management of red blood cell elevation in testosterone replacement therapy patients or anabolic steroid users. Quick disclaimer, this is not medical advice, this is entertainment only. So if somebody is taking testosterone as testosterone replacement therapy or testosterone or other anabolic steroids, they might see an elevation in their hematocrit levels. Okay, so hematocrit level is basically telling you how many red blood cells you have in your blood, and the higher that level goes, the riskier of the risk for blood clots increases. So let's think of how testosterone or anabolic steroids increase red blood cell production. Okay, so we have testosterone, and testosterone tells the kidneys to produce a hormone called EPO, erythropoietin, and this hormone will signal the bone marrow to produce red blood cells. Red blood cells give you or transport oxygen to the rest of the body, so elevated red blood cell production can basically enhance your endurance, which is a good thing. However, if the amount of red blood cells is excessively high, then this can cause high risk factors, okay, blood clotting. So how much red blood cells do you want? So your hematocrit level should be lower than 54%. Higher than 54% is usually considered the danger zone. Okay, so once you reach 54%, your healthcare professional will most likely tell you to either discontinue with your testosterone replacement therapy or customize the dosage or switch to another testosterone or other medication. So let's see how different testosterone preparations affect your hematocrit levels. Testosterone cypionate and enanthate tremendously increase hematocrit levels. Why? Because the injectable, long-lasting form of testosterone, so we have testosterone here, we have thyme here, increases your testosterone levels for a prolonged time period. Let's say we have supraphysiological levels here, and here we have the days, and you can see that these elevated levels last for several days, and these levels, elevated levels of testosterone, will trigger excess amount of EPO, and excess amount of EPO will trigger excess amount of red blood cells and increase your hematocrit levels. So this is for testosterone cypionate or enanthate in general. Decanoate, the very long acting testosterone preparation that is injected every 12 weeks, is similar with the hematocrit elevations, a little different, but we can classify that at long-acting injectable testosterone preparation. Those are generally the most dangerous testosterone preparation in regard to hematocrit elevations. So if somebody has issues with elevated hematocrit levels with injectable long-acting testosterone preparation, they can switch to short-acting testosterone preparations. There are nasal sprays, there are oral testosterone preparations, and there's gel, testosterone gel. And those preparations are usually taken 2 to 3 times per day, and the elevations of testosterone are less pronounced as with the long-acting injectable, meaning that you barely get supraphysiological levels of serum testosterone, and hence the EPO increase is more moderate, and the stimulation of red blood cell production is also more moderate as compared to the injectable form, where you really have super high levels triggering a lot of red blood cell production. Within those short-acting testosterone preparations, it seems, according to research, that the nasal spray seems to be the safest option with regard to hematocrit level elevations. But I think that all of those short acting, so nasal, oral, and gel preparation, should give you some improvement if you switch from a long acting injectable form to those short acting forms of testosterone. Other options, there is phlebotomy, so you can donate blood. Usually donating blood 500 milliliter should improve your hematocrit levels by 2 to 3% depending on the individual, but that's a thing you would have to do regularly. Or you can also completely stay away from testosterone and, for example, take Clomid or HCG, which would basically trigger your own endogenous testosterone production without giving exogenous testosterone, such as with those preparations. And the HCG and Clomid method is usually better tolerated for patients who tend to have elevated hematocrit levels, but also the testosterone levels achieved with those drugs are more moderate as compared with exogenous testosterone. And in some types of hypogonadism, HCG or Clomid might not work as well as the testosterone that is taken exogenously. All right, so again, monitor your hematocrit levels. You don't want them to go too high. If you go above 54%, even 52% is where you should pull the brake and say, I need to adjust something here. I need to adjust the dosage. I need to adjust the preparation I'm taking. Adjust something. Okay, please talk with your healthcare professional. What can you do to decrease your hematocrit level? Don't ignore it. Don't stay on an elevated hematocrit level for too long. Otherwise, this could lead to serious side effects. All right, I hope this video was helpful, and please let me know what you think in the comments down below. Thank you for watching.